W.F. House presents an unabridged recording of A Year to Change Your Mind by Dr Lucy Maddox, narrated by the author. Introduction. The way we think, experience the world and the other people in it, how we make decisions, it's all psychology. When things go wrong and we feel bad, or when our experiences tip into feeling so bad that they match the criteria for mental illness and severe distress, then clinical psychology and psychotherapy ideas can help. But we don't have to be at rock bottom to benefit from tried and tested concepts from the field of psychology. Many of those same principles can be useful for coping with universal human experiences that are less distressing but can still trouble us. We can use them every day to enable us to make the most of life. Using psychological insights to try to make things the best they can be is a rich area of research and practice. Over time, psychologists have turned to the study of optimal functioning as well as thinking about how to address difficulties. The American psychologist Martin Seligman had a lot to do with the shift towards positive psychology from the late 90s onwards, when he called for a change from only thinking about problems to instead investigating how best to build on strengths. The roots of the positive psychology movement go even further back, though, including the work of people like Carl Rogers, who saw everyone as having the potential to become the best they can be. The spectrum of human experience is just that, a spectrum, and many symptoms of mental illness are increasingly seen as one end of a range of experience which we all exist along. This isn't to downplay the severity of mental illness. Feeling a bit blue is different from feeling depressed, and having some tendencies towards worry is different from full-blown anxiety. But some of the approaches used in therapy for specific problems can be helpful in our everyday lives, and I often think that ideas I've shared in a therapy session are helpful outside a therapy context too. I use many of them myself. I started training as a clinical psychologist when I was 24. Looking back now, that seems young, but I didn't feel that young at the time. I came to the course at University College London in Bloomsbury from a year spent working as a research assistant into bipolar disorder in Camberwell, South London. Before that, I'd studied for a master's in neuroscience at the Institute of Psychiatry, which was also in Camberwell, whilst at the same time juggling several other jobs to survive the brutal reality of expensive London life. I worked at the Science Museum as an explainer on Saturdays, and I tutored Psychology A-level in the evenings. Before that, I'd spent a year in Paris teaching English, and before that, I'd studied an undergraduate degree in psychology, philosophy, and physiology at Oxford University.
Sample complete. Ready to continue?